Hi class, my name is Gilbert Fortes and this is my research project for this course, Analysis and Utilization of Research. And the title of this research study is Bedside Shift Report. Let me give you an introduction of what my study is all about. Institute of Medicine's Committee on Quality of Healthcare in America has issued its report entitled Crossing the Quality Chasm. The report created an immediate sensation with its estimate of 44,000 to 98,000 deaths annually, and the reason are due to errors in hospital care, which is said were due more to error-prone institutional systems than to mistakes by individual healthcare workers. The Institute of Medicine's report, Quality of Healthcare in America, mentioned that most of the problems in our healthcare system that are identified in the report describes the lack of communication and coordination among providers and between providers and patients, which is very important causes of reduced quality. The system's failure to rely on evidence-based guidelines as standards for practice is a project study that I want to focus on as the cause and reporting of such events and the means of preventing them. Next slide. Background of problem. Bedside shift reports are being delivered by the nurses at bedside during the change of shift versus group reports taking away from patients, which is the standard shift report at the nurse's station. The purpose or statement of the problem: bedside shift report enables accurate and timely communication between nurses, includes the patient in care, which is tantamount to the delivery of safe, high quality care. The bedside delivery of nurse to nurse handover at the patient's bedside could be implemented without reluctance if nurses are well trained and equipped enough with excellent communication skills to all sectors, namely to other staff and to the patient and family as well. Review of the literature. The study or article included an introduction, review of evidence, methods, results, and discussion of findings as the focus of the study, which are components of a quantitative study. There were 10 total references in the article, and mostly are current or within the past 5 years. Several nursing theories were described, such as the hospital's model format, and these are the SWOT format, or the strengths, weakness, opportunities, threats format, or Gene Watson's theory of transpersonal caring, also Christine Swanson's middle range theory of caring, and of course, which is the basis of my research, the Iowa model of evidence-based practice to promote healthcare. And OneSearch and ProQuest are the databases used in my research, with keywords such as implementation of the bedside shift reporting and its implication to the patients and nurses. Sample setting. Patient survey feedback is gathered or selected, analyzing how the implementation of a standardized bedside handoff can improve patient safety and satisfaction on an outpatient oncology unit performed by the nurses. Also, part of the sample setting, patient survey feedback should occur before and after implementation of the different approach of bedside hands-off, before the start of the shift of the incoming staff nurses, and before and after lunch breaks by relief staff nurses covering staff nurses during their breaks. For the data collection, patient engagement plays an important factor in how effective bedside reporting will be on this study. Patient engagement on this study seems to be a prerequisite as an important factor to collect the data needed in the research. Design. Patients and the nurses are considered a number of subject groups. The following PICO question: does the implementation of bedside shift report as compared to standard shift report at the nurse's station increase patient safety and patient and nurse satisfaction? The concept of patient engagement and the PDSA cycles will guide in the implementation of bedside shift report at the patient bedside. PDSA cycles will apply as the research intervention to practice change in real time. This type of quantitative research and design will guide my study in answering this research question. The study involved are the patients and the family members, which is a collaborative relationship between the patients and the family and the nurses, and could lead to increased satisfaction of both parties. An institution-wide adoption of a standardized handoff system will collaborate between the nurses and the patients. Their shared effort will be determined if the project has barriers based on the answers from the survey questions, which is part of the procedure is the nurses and the patients and the research subject. Our team of incoming and outgoing staff nurses will use the synergy model for the quality improvement and the PDSA cycles to test changes in the system. The PDSA framework will focus on transforming the change of shift reporting from location where it was done at the nurse's station to a patient's bedside, which is the plan is to implement practice change, which do is to apply the system as a policy change practice, and studies to assess how useful and safer the system is, and ACT is to improve the implementation of the study findings. For the instruments, patient survey feedback will be utilized before and after implementation of the new approach of bedside handoffs. Patients who possess the capacity to make decisions will agree to participate in the completed service and return them to a member of the project team. Also, all staff members in the unit will be given a questionnaire to assess staff satisfaction with bedside handoffs, and also nurse satisfaction survey report, which consists of a questionnaire designed to measure the effectiveness and efficiency of the change of shift report system. And I'll be using the patient activation measure, or the PAM, which asks respondents to rate their level of agreement with a list of items related to knowledge, skill, confidence for managing their health. Next slide, analysis of data. It is appropriate in this study or case where patient satisfaction is measured as pre and post or compared from the 4 months before implementation to the 4 months after the implementation. Each subject is measured twice, resulting in pairs or observations or data. The study of patient satisfaction survey result is measured using independent samples, t-tests, or the two-tailed to determine the statistical significance of the data. For example, in 4-month study, if a total of 50 shift reports, 25 before and 25 after bedside shift report implementation will be observed at time. If the statistical significant difference between the mean time for the report before and after implementation of bedside shift report, for example, in 4-month study, 25 before and 25 after will be observed at time, as I've said earlier. Limitations. A limitation of this project was that the evidence-based quality improvement design prevents generalization of findings to other settings. However, the knowledge gained may be transferred to other units or hospitals. Results of the nurse survey suggested an improvement to communication and teamwork will affect patient safety. However, it may necessitate future research. For the implications, the change of shift communication will provide several benefits. One is to perform safety checks, and also the patient safety matrix will also improve on the unit after the adoption of the new handoff system, like reduce cases of falls with injury or fewer reports of medical errors. Bedside Shift report will also offer clear patient education and encourage them to teach back the information that they learned to the nurses to demonstrate understanding. So, with my research question, does the implementation of bedside shift report as compared to standard shift report at the nurse's station increase patient safety and patient and nurse satisfaction? Numerous studies support the positive impact of bedside shift report on patient fall rates, reduction in medication errors, as well as patient and nurse satisfaction. The practice of shift report at the bedside is not a new concept and is well documented in a lot of literatures. Conclusions. Bedside shift report is a significant change to the current shift report practice and culture of most organizations, but it is associated with both improved patient safety and patient and nurse satisfaction. The Iowa model of evidence-based practice to promote quality care is one of the models that I use. This model can help nurses and other healthcare providers translate research findings into clinical practice while improving outcomes for patients. The use of evidence-based practice models such as this is useful to nurses to organize the practice change and provide them with a step-by-step process on how to make the change for a unit or organization. And these are my references, and that winds up my presentation for this class. I hope I'll be successful with my project in my unit, and this class as well will hone me more towards my leadership skills in nursing. Thank you so much.